Welcome to the Better Birth Workshop. If you have had a negative birth experience and you want to prepare for a better birth, this workshop is for you. So, a negative birth can feel like a weight that you have to carry. And this workshop is about preparing for a better birth. But it's also about lightening that load of that prior birth experience. So, the Sterling birth method, if you have gone through other birth classes before this may seem very different and even strange compared to what you've done before. Because this birth method is a birth philosophy and a birth preparation program that centers you and what's right for you and does not promote a particular version of birth as being better than another. Other birth methods are really focused on preparing for labor and birth. That is the whole focus of the birth method of the classes. This birth method is about really lightening the load of those fears, worries, and concerns that we carry with us through our entire pregnancies. And sometimes, even when we're trying to conceive, we're already worried about these things. So, it's about lightening the load of those concerns and those fears as you move through your pregnancy. And it's going to help you process and integrate your birth postpartum. So there are three phases to the Sterling birth method. There's the first phase, which is creating clarity. Second phase, you're going to become a birth baddie. Then you give birth. And then you enter the third phase, which is the phase where we integrate your story. So, we are currently in the create clarity phase, and we're creating clarity about what's important to you because this journey is not about the right way to give birth, but rather the best way for you to give birth. So, the first um, workshop, the first part of this phase was the Illuminate Values and Fears workshop. And I'm just going to briefly summarize what that workshop was about. So, in pregnancy and birth, there's a lot of choices and decisions that have to be made. And really, every choice that we have to make when we're trying to conceive, when we're pregnant, there's a weight to each choice and every decision. When we know what's important to you and what your priorities are, it makes decisions easier and it makes the best choice clearer. So, we're lightening that weight of all of those choices and decisions. In addition, if we illuminate your values, if we know what your values are, it makes it easier to create alignment in your birth experience. We illuminate fears because fears are going to influence our decisions and behavior no matter what. However, when our fears are in our subconscious, we're going to take instinctual actions based on those fears. So, a great example is if you have just this kind of underlying fear of cesarean birth, but you're not really thinking about it, you're not fully conscious of this fear and where it comes from and what it's all about, just kind of hanging out there that, oh, I don't want a C section. What that does when it's living in our subconscious is we may take instinctual actions like avoidance. So when we get to the C-section chapter in the book or in the course, we just skip over because that's not the plan. So we want to bring fears to the conscious mind because that's where our higher order executive functioning is. That's where our creativity is. So when we bring fears out of the subconscious into the conscious, into the light, we can actually address them rather than just having them influence our behavior through these instinctual actions. So, create clarity has two main parts: illuminate the values and fears and navigate the unexpected. And this is a really important class because it's learning about birth can be triggering and overwhelming. So before we move into becoming a birth baddie and learning all of the things, I want you to have a really strong foundation, a safety net. I these things may happen. I'm learning about things that may happen, but I have some simple coping strategies that I can rely on when the unexpected happens. However, and this is where we are right now, for people who have had a prior negative birth experience, there's more baggage that we're bringing into this second birth. And so, in order to truly create clarity, we can't just illuminate fears and give you some tools to navigate the unexpected. We really have to go back, address the past, and create a plan. So, that is what we're doing right here, addressing past and creating a plan. That is the Better Birth Workshop. And so we are going to do three things in this workshop. Number one, we're going to talk about finding the right provider. Number two, we're going to talk about 3 steps to move towards a more centered and empowered birth. And number three, we're going to talk about communicating and advocating with your healthcare providers and with your support team. So let's start with finding the right provider. So, my wish for you is that you find a provider who makes you feel safe and makes you feel heard. I want you to find a provider and have a provider that's the right fit for your level of risk. So if you had a really serious pregnancy complication with your last birth, maybe a midwife isn't the right fit for your level of risk. And maybe we need to be talking about like a maternal fetal medicine specialist, a high risk pregnancy doctor. In addition, we want you to have a provider that has privileges at a hospital and birth center that is the right fit. So these are some slides from the new I've taken slides from the Trying to Conceive course that we're launching and the new pregnancy course that we're launching. So you may have seen this. If you're watching this on demand, you may have seen this in another course. If you are watching this now, you'll probably see this again. So when you're choosing your provider, we want to think about hospital privileges, and that just means a physician can have an office anywhere, but they can't just deliver at any hospital. I can't show up at any hospital and deliver babies. I have to go to a hospital where I have privileges. I have an agreement with a hospital. So most OBGYNs have an agreement with one hospital. Some have an agreement with two hospitals where they can deliver. So you want to think about where does this doctor have hospital privileges? What's the style of their practice, their personality, and their philosophy? These are the things to consider. Now, if you're in the United States, it can get a little bit tricky because really the limiting factor a lot of times is insurance. So the first step is really figuring out, okay, what hospital and what group is in my network, is in my insurance. Once you have narrowed down to that list, then you can look to family and friends and get some recommendations from other people and say, okay, what do we think about these different practices, these different hospitals? And once you have a smaller list, you can do some more in-depth research. And the things that you want to research in a provider and in a hospital or birth center is, okay, what kind of services do they have for babies? And we're going to talk about that in a second. What's their, if breastfeeding is important to you, what's their lactation support look like? So different hospitals will have different ratios of lactation consultants to patients. And if you are going to a hospital that only has one lactation consultant but a lot of deliveries, then that may not be ideal for you if breastfeeding is really important or if you've had difficulty breastfeeding before. And then if you are wanting something like a VBAC, that's another thing that you want to make sure that you have a provider who is VBAC friendly, and the hospital actually offers VBACs. There are certain requirements for hospitals to be able to offer VBACs. So a lot of hospitals don't meet those requirements, and so they don't offer them. Okay, so I'm not going to go through all these different levels of baby care. If you are watching this on demand, you can download the slides where you're watching this video, and if you're watching it live, we're going to send you the slides so you can go through this and read it on your own time. I just want you to realize that there's different levels of baby care. So we start at the very beginning. Level one is just a newborn nursery. They do not take care of sick or premature babies. So if you are premature, they're going to ship your baby to another hospital. If your baby's sick, they're going to send your baby to another hospital. So there's sometimes we see moms and babies being separated because the level of the NICU is not high enough. So there's different levels. There's level one, two, three, and then you go all the way up to level four, which is a regional NICU. So depending on what happened in your prior birth, you may want to make sure that you're in a hospital that has appropriate level NICU. Okay. And then there's different practice styles. So we have solo providers, OBGYNs, it's just them. They deliver all their own patients, small groups, large groups. And then you have groups that are also a mix of OBs, midwives, physician's assistants, nurse practitioners. So getting an idea of what practice style feels good to you is also helpful in choosing a provider. And then researching your provider, of course, talking to family and friends can be helpful if you have any, family that's nurses or other physicians. They're good people to ask. You can check for board certification. If you're in the United States, it's abog.org. Good idea to go to a board certified OBGYN. That's just somebody who's gone through additional levels of testing and screening to be a board certified OBGYN. You can also check their state medical license. So you would just Google your state and medical license, and there are certain things that, if they have a history, they've been reported to the medical board for, a misconduct, that will show up, on their medical license, so that's a good place to look. And then you can look at their medical school and residency, and if they went to a place that has a really, fancy name, I think that's something to take into consideration. I would never make a full decision on a physician just based on their medical school or residency, but it can be a good indicator that this is somebody who knows their stuff. Okay. So, really what we're trying to get at here is, I really want you to have a collaborative relationship with your provider. And you know, to assess if this is going to be a person who's going to collaborate with you and help you. There's some kind of open-ended questions I want you to think about asking your provider. So if you had a birth complication, a pregnancy complication, like eclampsia, you had an eclamptic seizure. When you are assessing if this provider is the right fit for you, you can ask them, what is your experience with fill in the blank complication? Okay. You can also, if you would describe your prior birth as traumatic, you can ask them, what do you think about birth trauma? I'm a really big fan, and this is true for, assessing any healthcare provider for the rest of your life. I'm a really big fan of just asking open ended questions and not leading them in the direction that you want to hear. I want you to just ask the question very straight face and let them tell you and just listen to what they say because you'll get a more honest answer. So some of the red flags just to be aware of, if you ask your provider, like, what do you think about birth trauma? And they say something like, well, all birth is traumatic, or anything about it, oh, it's just so it's being exaggerated. It's so trendy these days to talk about birth trauma, or anything about blaming people's expectations. Like, well, if people just didn't have high expectations, then they wouldn't have birth trauma. That to me is a red flag. It doesn't mean that this is not a good person. It just means if you have a history of birth trauma, I really want you to be taken care of by someone who's somewhat trauma informed and not just really know nothing about trauma. And these are signs that this person doesn't know anything about trauma. And then the other really nice open-ended question to ask a provider, and you can, even if you're not switching providers, you can ask this of your provider. How do you support people who've had a negative birth experience before? Really will get some great insight into if this is the right provider for you. And even if you know it's the right provider for you, they may have some really great ideas that you haven't even thought of. Okay. The other thing to ask yourself when you're finding the right provider is, what are your non negotiables? And I hope that each and every one of you finds the perfect provider, the perfect OB who's just amazing in all of the ways. But most of the time, there's going to be it's not a perfect. There's something that you're compromising on. But you should know going into it what your non-negotiables are. So that may be a certain hospital, that may be a gender. You really want a female physician, you want a male physician. Most of the time with OB stuff, it's a female physician. A type of practice may be really important to you. You may want some, practice that has some midwives, and the location may be really critical. So whatever it is, know what your non-negotiables are because it will help make the decision easier. Okay, so as we move through, we're going to move into the 3 steps to a more centered and empowered birth. And so we're going to use an example to help us see how this works. So this is Rachel. This is a made up person, but this is a real situation. So Rachel pushed for 4 hours. There were issues with baby's heart rate. And so they attempted to do a vacuum delivery. And that did not work, so she had an emergency C-section, she had a hemorrhage, and her baby went to the NICU, okay? So, the first step to a more centered and empowered birth is, number 1, to address the feelings, okay? Now, I wanna make this very clear. Regardless of what your feelings are about your prior birth, it is not your fault that you feel that way. There's nothing wrong with you, with how you feel, and all of your feelings are valid. It can be really tricky when you have some negative experience tied to a birth of your child, and it's supposed to be, right, this really happy event, but you have negative feelings about that day or about that time. But, these are 2 s your love for your child is very separate from your experience with birth, and it's okay. All of those feelings are okay. So, um, in addressing the feelings, you wanna ask yourself, "How did my last birth make me feel?" And being really specific here helps. We actually have data that people who are able to accurately name the emotion that they're feeling or the feeling that they're having, it actually helps calm and make people feel more in control of those emotions. So being really specific with how you felt helps. So for Rachel's example, Rachel felt frustrated, she felt scared, she felt dehumanized, she felt panicked, and she felt disappointed. So you're going to also do this list. You can, if you're watching this on demand, you can pause, you can write this list now, you can do it at the end of the workshop, but we will be coming back to this list of how you felt when you were in labor. So the other way to address feelings is to ask yourself, how do I want to feel with this birth? Okay. So for Rachel, she wants to feel calm. She wants to feel seen and heard. She wants to feel knowledgeable, and she wants to feel comfortable with her team. And again, this list is something that we're going to come back to and continue to use. So, the third aspect of addressing feelings is to really ask yourself and be very honest with yourself if you would benefit from addressing the trauma with a licensed mental health provider. If you have trauma, if you had a really negative experience, sometimes we need that extra help from a licensed mental health provider. Um, and if you've gone through this, if you've done this, if you've done EMDR therapy or any of these special therapies for trauma, you probably know how useful it was. I wanted to make you all aware that Kaylee Summers, you may know her as the birth trauma mama on TikTok or Instagram. She's just a wonderful resource for people who have experienced birth trauma. I've had her on my podcast. She actually does birth trauma consultations. She can only do counseling in the state of Pennsylvania because that's where she is based. That's where she's licensed. But she can do birth trauma consultations anywhere. And so where you're watching this video, if it's on demand, you'll find a link to book a consultation with Kaylee. And you can also, and if you're live, we put it into the chat. She's a really invaluable resource, and I wanted to make sure that y'all knew that she does those consultations because she's incredible. Okay, so we're going to come back to these first two questions, but we're going to move on to the second step to a more centered and empowered birth. And that is to address what happened. And this is where you want to be really, really specific. So, some of you may already know everything that happened in your birth. You may understand all of the specifics. If you don't know what happened, there are several options for you. One, you can make an appointment with your OB provider to review your birth. And it will be helpful for you to get your medical record from the hospital before that appointment if you don't already have it. All hospitals are required to provide your medical records to you, and you will ask for your labor and delivery notes, and they will provide that to you. So you can make an appointment to review your birth. Make sure the person scheduling the appointment knows the purpose of the appointment, because unless your birth was traumatic to your provider, they're probably not going to remember the details in, or unless it was traumatic to them or if it happened yesterday. Otherwise, they probably won't remember a lot of the details, so they will need to review your records before they have that appointment as well. Now, some of you may not want to go back to your old provider, and that is totally okay. In order to really figure out what happened, you can get your medical records and you can review them with another doctor. And if you had pregnancy complications or birth complications, you can also consider having an appointment with a maternal fetal medicine specialist, which is an OBGYN like me who's done an additional 3 years of training in high risk pregnancies. And um, they can look at your medical record and give you their perspective as a high risk pregnancy doctor. And it may be beneficial to also bring them your prenatal records, particularly if you're worried that something was missed in your pregnancy or something wasn't managed correctly. Personally would want to go to a maternal fetal medicine specialist and have them take a look at my prenatal records and my birth records and give me their assessment of what happened. So you get specific about what happened, the specifics of your birth, and then you ask your provider, either the same one or a new one, to give you a list of things that can be done to mitigate or reduce the risk of what happened happening again. You can also bring those to me too. So, in order for me to help you come up with a list of things that can be done to mitigate the risk of it happening again, I have to know specifically what happened. So that's why it's really helpful to know the specifics of your birth, because in order to create this list, you need to know the specifics. So, an example for Rachel, this is what happened to her. A list of things that can be done to mitigate this from happening again or reduce the risk of this happening again could be, consideration of a trial of labor after a C-section versus a repeat C-section. Which way do we want to go? We can consider putting a time limit on pushing. She pushed for 4 hours, and that really contributed to how she felt during her birth. We don't have to push for 4 hours again. We can put a time limit that feels good to her on pushing before we get there and say, hey, let's push for an hour and see where you are. And if you're not making any progress, maybe we don't wait another 3 hours. Maybe we just say, all right, let's move to C-section now. Or after an hour, you're making great progress. Cool, let's continue. So that's something that can be done. Also, when you come in, if you're coming in for her, the induction at the beginning of labor, let's do an ultrasound to assess fetal position, make sure baby's not sunny side up and we're not getting ourselves into a 5-hour pushing situation, right? We can get several different estimates of fetal weight at the end of pregnancy, and she had a hemorrhage. So we can have medications and tools ready to treat a hemorrhage in the room. So this is just an example of what a mitigation list can look like. So, the other way to address what happened is just to talk about it with other people. You can talk about it with me, you can talk about it with your pregnancy pod. There's the VBAC support group if C-section was part of your experience and you're considering a vaginal birth after a C-section. We have the VBAC support group, which is actually meeting later this week. You can talk to your pediatrician, trusted family and friends. I just want you to really feel that you deserve support. You deserve support from the experts, the healthcare providers in your life, and you also deserve support from your community and your people, because this is hard. Having a negative birth experience before, especially if you're pregnant or trying to conceive right now, it's hard. So, the third step to a more centered and empowered birth is going to come up with a preparation and mitigation plan. So, let me explain that a little bit more. Remember the question, how do I want to feel in my next birth? So you're going to take that list. How do I want to feel in my next birth? And you're going to bring that to your OB provider. You can also bring it to me. And with that list, discuss what preparation steps can be taken. Essentially, what we're doing here is reverse engineering. This is how I want to feel. What can I do to help get as close to that as possible? Okay. So in Rachel's example, she wants to feel calm. She wants to feel seen and heard. She wants to feel knowledgeable and she wants to feel comfortable with her team. All really reasonable and wonderful things to feel in birth. So Rachel brought this list to me. This is what I would give back to her. I'd say, okay, if you want to feel calm, let's start the Sterling Parents Mindfulness Program, because that's what mindfulness is. Mindfulness is the ability to have a place in your body and in your mind that is calm, even when everything else is crazy. So and overwhelming and all over the place. So the mindfulness program is the perfect tool for someone who wants to feel more calm and centered in life in general and especially in birth. So that would be the first thing I would recommend. And then I would recommend for the seen and heard, watching Navigating the Unexpected, which is the class after this in the Sterling Birth Method program. And that class goes over a lot about creating a collaborative environment, an environment of consent with your healthcare providers. So that I would have her watch that. Then she wants to feel knowledgeable. So learn about trial of labor and repeat C section. Okay. Learn about it, become a personal expert in what this, what trial of labor looks like, what the risk benefits are, what a repeat C-section can look like. So I would say the Confident Birth After Cesarean course is a great place to start and to learn all about that. And then, of course, join the VBAC support group, because in addition to knowing the risk benefits and knowing all of the numbers and knowing that, it's really helpful to be in community with other people who are going through something similar. And then comfortable with her team, in order to prepare her to feel comfortable with her team and do everything we can so that she's comfortable with her team in this next birth. One, I want to know what makes her feel comforted. So we need to get more specific there. And then make sure that the birth plan that she creates at the end of the Sterling Birth Method program, make sure that that birth plan is lined up and will help her create that comfort. So this is just an example. This is a preparation plan. Okay. So the mitigation part of the plan, the good news is that you have already created the mitigation plan. When you asked your provider to give you a list of things that can be done to mitigate the risk of that happening again, or you asked me and we came up with that list together, that is your mitigation plan. Okay. So this is Rachel's mitigation plan. She has a preparation plan and she has a mitigation plan. So these are all the things that she can do to move herself to a more centered and empowered birth. So this is what we've done here in moving through these 3 steps. This is a very common way to feel after a negative birth experience. I'm afraid of giving birth again. It was such a bad experience, and I'm worried it will happen again. This is one of the most common things I hear about negative birth experiences. So what we've done is we've taken such a bad experience and we've broken it down. So we got specific with the feelings. It was a bad experience because I felt this way. It was a bad experience because this happened. Okay. So we break that down and then we address specifically the fear that it will happen again. And that is coming up with a preparation and mitigation plan. Okay. Now, this is the beauty of moving through a prior birth experience in this fashion, because it's not just about getting a better birth. That is important, but it's also about decreasing the stress when you're trying to conceive and when you're pregnant and as you move through it. And the good thing is that plans are calming to our brain. When we have an overwhelming situation, difficult memories, fears, worries, concerns, when we can break them down and come up with a plan, just the act of creating the plan calms our brain. So, this is about lightening that load as you move through your journey, in addition to helping you get to where you want to be with your next birth. Okay, so let's talk about how to communicate and advocate. Okay, so the first tip I have for you is to center the human in your healthcare providers, a midwife, a nurse, a doctor. And you can use this for the rest of your life. This is my tip for not just birth, but any healthcare provider. Because if you center the human in your provider, they are a decent human being, they will likely respond in kind. Now, we're talking about very basic stuff. I'm not talking about something elaborate here. I'm talking about eye contact and asking, how are you doing? Very basic things. Now, you are probably already doing this. This is just being nice to people, okay? It's nothing elaborate. But when you have the intention, before you have an interaction with a healthcare provider, when you have the intention, okay, remember, I'm going to center the human being. I'm going to look in their eyes. I'm going to ask them how they're doing. When you have that intention, And then you show up in that space with that other human being, and you are paying attention to how you're centering the human in that provider. You are going to increase the impact of the actions that you're probably already taking. And I think that this is such a critical tip that I feel like we don't talk about enough, because your healthcare providers, all of us, they're burnt out, they're overwhelmed, and they are so frequently not treated with this that it stands out. It truly, I can remember, having a really busy day in the office and having a patient say, "Oh, you look really busy. Are you okay?" I almost cried, y'all. I almost cried. It made such a big difference, and all of a sudden it's like, "Oh my gosh." It changed how I saw that person immediately, and I showed up as a better version of myself for that patient. So I want that for each and every one of you. I want you to get the best version of the healthcare provider that's in front of you. Okay. The other thing that I want you to do is I want you to talk about your why for wanting a better birth. I want your providers to connect with you. When we connect with our patients, we're so much better. We're just better physicians. We're better, and I'm sure nurses would say the same thing. When we connect with our patients, when we can see ourselves in them, it makes a huge difference. So, sharing your why for wanting a better birth, maybe you share the weight of your prior experience. Maybe you share how you felt. Remember, you listed out how you felt, or you're going to list out how you felt in your prior birth. You can share that with your providers. So for Rachel, this might be what she shares with her providers. I was so scared and panicked during my prior birth. It robbed me of a lot of joy with my son, and I'm still carrying the weight of that experience. Sharing that is so powerful because naturally, if as a human being, you want to help. You want to say, I don't want that to happen to you again. What can I do? So, the next tip I have for you for communicating and advocating with your provider is to invite them as a collaborator. And this is what that looks like. So, you can say something like, I would like to work with you to have a better birth experience this time. And, you can bring this to somebody, you can bring this to your labor and delivery nurse. You can talk about this at the very beginning of your pregnancy with your provider. Now, if you are going to the same doctor or the same midwife who was a part of your birth the last time, you may want to preempt any defensiveness. When, as a provider, when a patient says to you, "My last birth was really negative," and you were the one who was there, it can feel like, "Oh, I did something wrong." And maybe the healthcare provider did do something wrong, but it wasn't something that was so bad or egregious that you didn't wanna go to them anymore, but they could have done better, right? But still, you want to reassure them when when you share that you had a negative birth experience and they were involved in the birth. You can offer some kind of reassurance, whatever you feel comfortable with. I don't blame you. I'm not saying it's your fault, but it wasn't a good experience, and I would really like to work with you to have a better experience this time. Perfect, as opposed to not addressing the defensiveness they may have, and then um, you know you may get a different reaction from them. Mm. Okay, the other thing that I want you to do with your healthcare providers, is during your pregnancy, during your labor, is to share how you want to feel. I also want you to share with them your 3 birth values and statements that you created in the Illuminate workshop. Just as a reminder, in the Illuminate workshop, you picked 3 to 5 birth values and then took those birth values and created statements from there. So Um, for this experience, I want you to make sure that we are moving you towards an experience that's more centered and aligned with your values. I want you to bring those how you want to feel and bring your 3 birth values and statements. I want you to bring those with you, either to labor and delivery if you're going in for a vaginal birth or to pre-op if you're going in for a C-section, and share them with your healthcare team before birth, with your doctors and your nurses, and after birth too, because our experience with our postpartum care is also really important. And just so that you know, we will be putting all of this together at the end of the program when we create your birth plan. You'll put all, how I want to feel. You'll put your birth statements and all of that together. So it will be all in one place, but just know that you're going to be referencing this again later to come back when you create your birth plan. So this is an example of what it would look like for Rachel. So she would bring this to her um, her OB, she would bring this to her labor and delivery nurse or to her pre-op nurse, and it would just say, I want to feel this way and I value. So Rachel's birth values were, understanding, health and safety and collaboration were her birth values. And so the statements that she created based on those values, I value understanding what is happening in my birth. I value the health of safety of me and my baby, and I value collaboration with my support team. And this just sets you up for, such a this sets you up for an experience with your providers that is so much more centered in you than in them. And we're going to talk about this more in the Navigating the Unexpected class, but it's really important for your values and how you want to feel to be centered in your birth experience and not necessarily the values or the priorities of the rest of the team, right? This is about you and your birth experience. Okay. So, the final tip for communicating and advocating is just consider a doula. Not right for everybody, but it may be helpful for you. Now, you want to be careful with doulas who have a really specific version of the birth that they want you to have. Okay. So, again, same thing with doulas as with healthcare providers. I believe in open ended questions and just letting people share their perspective so that you can get a really good gauge of, is this a good fit for me? So, if you are looking for a doula, by the way, doulas people who have repeat C sections have doulas. Oftentimes, sometimes they come into the operating room with them, but a lot of times they're just there before and after. So, um, you can ask questions like, what do you think about cesarean birth? What do you think about OBs, midwives, etc.? If you have a really good relationship with your OB and then you're interviewing a doula and they're like, well, I think OBs are terrible. And you're like, but I love my OB. There might be some friction there, right? And then the other thing you can do is you can say, okay, here's how I want to feel during my birth. How would you help me? And they will, share what they think that they can do to help you have that experience where you feel that way. And you're either going to say, that sounds fantastic, or you're going to say, that doesn't feel great to me. I'm going to keep looking. Okay, so let's review. First, finding a provider with whom you can have a collaborative relationship with. I want you to have the right fit for your specific history and your level of risk. So I want you to have somebody that you can have a collaborative relationship with, but also is a good fit for, what happened to you in your prior birth. In order to get at if this person is going to be the right fit for that collaborative relationship, you can ask open-ended questions of them. And then also being really clear on what your non-negotiables are so that you can find the right provider for you. Okay. We also got really specific and broke down this bad experience that happened to you. We want to address how you felt, what happened, and how you want to feel. We want to break it down into its component parts so it's not just this overwhelming negative experience with these bad memories attached to it. What actually happened? How do we actually feel? How do we move away from that? And then we address the worry and concern that it will happen again by talking about this preparation and mitigation plan that everybody can come up with. So we're going to basically reverse engineer how you want to feel and the steps you can take to prevent this recurrence. And we do this because not just getting to the birth we want is important, but also that creating this plan helps create calm and decreases stress as we move through our reproductive journey. So we want to do this. Really, it's never too early to do this. I have walked people through creating this preparation and mitigation plan while they're trying to conceive, before they were trying to conceive. Sometimes people have a negative birth experience and they don't even know if they want to have another baby again because of this. Coming up with a preparation and mitigation plan is the perfect way to assess, do I feel good enough with what this is, what I've created here? Does this feel reassuring enough that I can move forward with having another baby? Okay. And then tips for communicating and advocating with your provider. Center the human in your provider. Share your why. Invite them as a collaborator and invite them as a collaborator. Okay. So next up in this series is navigating the unexpected. And we're going to go over the confident decision framework. We're going to address communicating when you're in labor or you're in pre-op before your C-section or in the operating room with your C-section. And we're going to talk about consent as well. And we're going to talk about questions to ask your provider about unexpected interventions that come up. Okay, let's get to the Q&A. Perfect. We have time for a Q&A. Wonderful. So go ahead if you have any questions. You can drop them into the chat and we can get them answered. And this is your time, so you can ask me anything. There's no rules. Okay. Is it possible to make sure that the OB who cared for you throughout pregnancy is the one who delivers the baby? I guess it's impossible to achieve 100%, but my impression with my first birth, that was a 0% chance. Pretty big hospital, didn't even call my OB. Yeah, it depends on, Janet, that's a really great question. So basically, it depends on the style of practice. Okay. So the real only way to 100 get close to 100% with your OB being the one who's there to help you give birth is a solo practice. Very uncommon these days. Very uncommon, but there's still some providers out there who are solo practitioners. The best chance would be to do a small practice. So a small practice, like 3 or 4 doctors, that still happens. Or a practice of you can also find practices that have an OB and a midwife and they work together. But one thing that you can do, obviously, if you're having a C-section, you could pick who's doing your C-section, but you can do an elective induction or induction when your provider is going to be there. And that's one way to increase the odds, but it really depends on the practice style. So if you have um, a huge group of like 10 plus doctors and midwives, really the only way would be to have an induction. If you had a really special relationship with your provider, they may be on call for your delivery. Um, Typically, OBs only do that when it's like a friend or a family member, because if you might have clinic the next day, you might have to operate the next day, so it's hard to be on call for even very special patients. It's hard to be on call for them. Okay. Okay, Becky says, question about IVs. How to talk to someone about a better place to put it without sounding crazy or high maintenance. Becky, I don't know if there's any nurses who are watching right now, but what I would say is that nurses, in my experience, are very open to hearing your input on where it works and where it doesn't. They don't want to stick you more than once. So I would not, and you can say like, "Hey, I don't want to sound high maintenance or anything, but I'm a tough stick, and just so you know, this is the place to go. This is much easier for people." That doesn't come across as crazy or high maintenance at all. People who are tough sticks, it sucks. It sucks to have to be poked, and they don't want to do it. Can I have a midwife and an OB? What is the main difference? Okay, really, really wonderful question. So you can potentially have both. If you are if you're going to a practice that has both obstetricians, gynecologists who are medical doctors, they've gone to, um, 4 years of medical school, they've done a 4-year residency. So, OBGYNs are medical doctors, and then midwives, there's different types of midwives. The midwives that work with OBGYNs are almost exclusively in the United States what we call certified nurse midwives. So they were nurses first, and then they went through additional training and schooling to become certified nurse midwives. Now, certified nurse midwives are basic, their bread and butter is low risk pregnancies who are, likely to have a vaginal delivery. Okay, they do not perform C-sections. They can help OBs take care of high risk patients and often do. Where I trained, we worked with midwives all of the time and they helped us with the high risk patients, but they were not the primary caretakers of high risk patients because they are not trained in all of the medical problems that can happen in birth. So we oftentimes work together. But you can also, for example, I am relatively low risk, uh, and I have had midwives with all three of my pregnancies. Even this last pregnancy, where I was advanced maternal age and I had a history of a macrosomic infant, so a big baby, I was still able to be seen by midwives. So in general, midwives have if you are cared for by a midwife when you're in labor, you have a lower C-section rate and a lower risk of intervention. So they're a little bit more. They take a little bit more of a hands-off approach. I love midwives. I think they're fantastic. Okay. Uh, Romina said, how do you suggest connecting with your provider when you are giving birth at a hospital like Kaiser, where you get whatever doctor is on call that day? That's such a great question. I am also a Kaiser patient, so I've been there. What I will say is midwives and OBGYNs are very good themselves at establishing connection and intimacy quickly because we are let into the most intimate periods of people's lives, right? This is we are we have to make people feel comfortable in really uncomfortable situations all of the time. So I think the good news is that and labor and delivery nurses too are so good at this. But I would say all of um, everything that we've talked about here in this workshop, if you do the things that are in this workshop, you are going to be connecting to your provider. If you are centering the human being, if you are sharing your why, if you are inviting them as a collaborator, if you are sharing how you want to feel, how you felt before, all of this is bringing them to a place of, okay, this is someone who had a difficult experience last time and I really want to show up and help them. So yeah, if you do these things, you're going to be really connecting with that provider. Okay. I love my OB practice. I had a negative experience with one of 9 providers, and all trust was lost on my end. Would it be worth bringing it up with her even though there's only a 1-9 chance she delivers me? I am already worried about the idea of her delivering me. Thank you. 100% Erin, and you answered the reason why in your question. I am already worried about the idea of her delivering me. So even though it's likely that she will not deliver you, you are carrying the weight of that concern with you. And I don't want you to have to carry that. So I think that it can be difficult to have a conversation with the provider, but telling her how you feel and explaining, I'm this occurred and it made me feel this. And now I don't feel comfortable. I don't feel have the same degree of trust and comfort with you that I once did. And I'm, again, really a big fan of just leaving it open, saying that and letting her respond because it is her job to respond and reassure you. If you are part of this group's patients, you are her patient and it's her job to make you feel comfortable. And if she doesn't, then I would also think it's a good idea, even before you reach out to her, you may want to talk to one of the other providers that you trust and just tell them what happened and get their advice because they know her. And maybe they will I have, had patients come to me with this type of situation. We had a really close relationship. One of the other, um one of the other OBs said something that really turned them the wrong way, and so the patient came to me. I went to the other provider because I knew how I could talk to her about it and have a beneficial outcome, and then she was able to reach out to that patient and apologize. So there are different ways to do it. Alexa said, "Can I still ask for my records from L&D if my birth was 2 years ago and I left the practice?" 100%. They are required to keep your birth records, until your I wanna say it may change based on state. In California, they have to keep your birth records, I think, until, 18 years after birth. So, you get your prenatal records from the office, and they are required to keep them as well, and you get your birth records from the hospital or birth center where you gave birth. Okay. I think I know exactly what process would be for a planned C-section would make me feel much better. Arriving where the ORs are in the building when my husband can be by my side. How can I frame that to the provider? What kinds of questions can I ask? Let me read that again. I'm not quite sure if I'm understanding the question, but um when it comes to C-sections, there's the protocols are pretty standard. So I would get what I would do if, I had an idea of what I wanted it to be like, I would first ask what it's like, what's the process, what's the protocol? And then from there say, "Okay, could we do this? Could we do this?" Let me know if that's answering your question. Um, and this might be a better question for, we have office hours next week for Sterling parents. And so that might be a better question for office hours so we can chat face to face. Okay, what does a doula do during the C-section if they can't be in the operation? So, some doulas do go into the operating room. Typically, when I've seen doulas in the operating room, it's when a partner was really squeamish and not somebody who wanted to be in the operating room, or partner was, military overseas, something like that. But, doulas can a doula is just a support person. They don't have any specific training. And so if having somebody, you know, it could be a friend, it could be your mom, it could be a doula that you've actually paid to be there with you. If there is a person whose presence makes you feel safe and calm, that person is essentially a doula, and you can have them there, and you can have them there afterwards to help take care of you. Um, you know, doulas, there's postpartum doulas. A doula can There's no definition to what a doula does because their main definition is to support you. So that's whatever it looks like for you. Okay. Had an unplanned C-section that was traumatic, feeling some pressure to attempt a VBAC, but I'm so scared of another unplanned C-section. Any suggestions for how to weigh the two options? Yeah, Laura. So it is, I would say that learning about the different, you know, learning about a trial of labor after a C-section, learning about VBAC, will be helpful because as you learn about it, and you learn about your likelihood of having a successful trial of labor after a C-section, having a VBAC, will really be helpful. So that is what the Confident Birth After Cesarean course is all about. So it's a 3-part course. You go through that, you learn all about the risks and benefits, you learn about, okay, what would it look like to prepare for a vaginal birth? What could I do to increase my chances of vaginal birth? And then there's a whole part of that course that talks about making a confident decision, a decision that's right for you. And I will say, a lot of times people go through the Confident Birth After Cesarean course and they decide that a repeat C-section is the right decision for them. But they do so once they go through that, having fully explored the other side. And so they're able to say really confidently, like, oh, I'm not just going to a repeat C-section because I'm scared. I have weighed both of these decisions, and this is what feels right to me. And just in case, I don't know, um, those of you who are not members of Sterling Parents already, um, we are going to allow you to, if you want to continue as a member of Sterling Parents and go through more of the birth content or have access to more Q&As with me and all of that fun stuff, we are have a link that you can, and we'll email you the link as well, a link so that you can use what you paid for the workshop towards a membership with Sterling Parents if you want to kind of continue exploring this. Yeah. Okay. I had a bad experience with a resident who was checking my cervix at the beginning of the labor last time. How do I prevent another resident from hurting me this time without sounding demanding? That's a great question. Okay, so one, I wouldn't say that it's um it depends on, obviously if it's a brand new intern, okay, maybe it's their level of experience had something to do with the cervical exam, but most OB residents have done hundreds, if not thousands. I mean, you quickly do so many cervical exams. It's a skill that you get better at quickly. So I will say that sometimes cervical exams are just uncomfortable. With my third baby, I mean, I know all the tricks and I feel super comfortable, y'all, with getting my cervix checked, with the whole situation, and they were still really uncomfortable. So one, I think it's really important to tell your provider, I'm really uncomfortable with cervical checks. And so they can, when we know somebody is really afraid or scared of cervical exams, we go slower. We can say, okay, I'm going to put some pressure here, and then you're going to feel this. And I always ask, and you can ask for this as well. When I'm doing a cervical exam and somebody who's really uncomfortable, I keep checking in with consent. Is it okay if I continue? Does this feel okay? So you can ask, like, hey, as you go through this, will you just check in with me? Because I had a really bad experience and I just want to feel a little bit more in control of my body. Um, so I would say that is more important than saying, like, oh, I don't want a resident to check me. In some hospitals, you're not going to get the attending there to check to do every cervical exam. They just, if you do that, I mean, you could ask for it. You always can ask for it, but you may be waiting a long time because there's one attending and there's way too many patients for that one attending. I hope that answers the question. I had fourth degree tears with my first. I'm terrified of happening again. I'm consider requesting a planned C-section. Any tips on making that big decision? Um, well, I think that one, understanding what I would want to know from you, Fiona, is to know the specifics of what happened with your fourth degree. And you can review this with your OB provider. You can bring this to me at office hours and we can talk about, okay, was there any instrumentation? Was there an episiotomy? How big was baby? Talk about that. And then it's very reasonable when you've had a fourth degree to do a C-section. So there's going to be no problem there. Okay. Nobody's going to say, oh no, you shouldn't have a C-section. You should have a vaginal delivery. If you've had a fourth degree, totally reasonable to elect for a C-section. But what I would say is, in looking at the factors that what went into the fourth degree, what can we do to try to prevent that from happening again? And there's a list of, depending on what the factors were that fed into you having a fourth degree, that will change what we can do to try to prepare and mitigate that from happening again. And if then you look at that list and you're like, you know what, I know we can increase my protein intake, and I know that, like, we can do an assessment of fetal weight at the bit, but I'm looking at this and I'm still feeling like this is not the right decision for me. Right. It's not the right decision for you. But I think kind of going through and learning more about what you could do to prevent the fourth degree, that will be very telling for you. Janet, can you have a hospital birth and refuse to be woken up like 5 times overnight for someone to check your blood pressure or give you a prenatal over-the-counter painkiller? Yeah, Janet. So what you would do there is, with your postpartum nurse, you would say, I would like to put together any medication administration and vital signs or anything that's happening to baby, can we do it all at the same time? It's really your postpartum nurse's uh, job to kind of try to put all of those things together as much as possible so that we're interrupting your sleep as little as possible. Um, Postpartum has a higher ratio of patients than like labor and delivery. They have more patients than a labor and delivery nurse does. So, and you know, there's a lot of nurses who are leaving. So, short staffing is a thing. They've got a lot of new nurses, a lot of traveling nurses who are maybe not familiar with their system. So it can be hard, but you can definitely ask for that. When I was discharged from my last birth, that's when shit hit the fan. I felt like I'm going to be scared to be discharged. Any thoughts? Just discussing this with my OB. Yeah, I think again, talking about the specifics of what happened and really your OB should be feeling the same way. Like you don't want no doctor or midwife wants a bounce back. A bounce back is when you discharge someone and they come back and then they're readmitted. It is a ding on the hospital dings you. They do not like readmissions. It's a whole thing. So they don't want a readmission either. And so yeah, I would just say like I'm worried about being discharged and this happening again. What's the plan? How are we going to prepare for a different outcome? How are we going to, what is the mitigation plan? Okay. Ayla says, the question about C-section protocols, I want a lot of details about on what to expect since my first birth felt very out of control. I'm just not sure how to get across to a provider that I won't want more than a very high level summary of the process for C-section. Okay, yeah. So what I would say is then you definitely want to do a tour of labor and delivery and tell them I'm having a planned C-section. So I want to kind of see where I'll go throughout the day. And then you can talk to your provider. You can ask your provider to walk you through how they do a C-section. You can also say, ask them to actually narrate what they're doing during your C-section. I have had patients do all of the above. So I've had patients who said, "Can you narrate what you're doing?" And I've actually said, "Okay, now we're making a small cut into the peritoneum." I've given diagrams of what we do, and one of the things the we're creating for the Sterling birth method is a workshop on C-sections that goes over all of these details of C-sections, and that should be launching next month. So, Erica, you mentioned confident VBAC after cesarean workshop. Is this only available to Sterling parents, or I can purchase it separately? Yeah. So the confident birth after cesarean workshop is part of the Sterling parents membership. It's not available by itself. Okay. All right, wonderful. After my first birth, I thought I'd never be ready to give birth again. Between therapy and your course, I'm feeling much more confident. Wonderful, wonderful. Okay, any other questions before we sign off? Okay, Lisa. Record review to clarify what happened previously with a new provider. Do you recommend asking new provider to review all those records and then have a meeting, or simply reviewing records for my own clarification and determining my own priorities to convey to a new doc? So, what I would say is no, I would not give all of your records over to a provider to review. What I would do if you are going to a new provider and if you're already pregnant, that's a different story. If you're already pregnant and this is going to be your new provider, then they will be reviewing your prior records and going through them all. But if you're just going to them for just to talk about what happened with your prior birth and you're not currently pregnant, then you're going to want to go through your records. You can kind of highlight or sticky note or whatever and ask questions like, what does this mean? I want clarification on this. It's basically a preconception appointment, but your questions are more about, okay, this is what happened in my prior birth, and I want to have some clarity about that before I get pregnant again. Does that answer your question? Okay, perfect. Any other questions? This is perfect timing. I'm so glad we were able to get through everything more or less on time. We're a little bit over, but not too bad. Okay. I don't see any more questions. So, for those of you who are members of Sterling Parents, if you have any questions about what we've talked about, we have office hours next week. If you're not a member, you can click on the link that's in the chat and apply your whatever you paid for this workshop. You can apply it to membership, and we'll also email it to you. And you will get Sterling Parents. This is going to be plugged into the Sterling Birth Method. And for those of you who are not members of Sterling Parents, we will give you access to this recording separately. All right, y'all. All right. Thank you all. I hope you have a beautiful evening.